Hi, everyone, and welcome to another episode of ailahealth's Patient Spotlight series. I am here with Tammy Wilshire. She has a history of ME/CFS and contracted COVID-19 back in March of 2020. And since then, she has been struggling with long COVID symptoms, including severe fatigue, brain fog, dizzy spells, tachycardia, and low blood sugar, just to name a few. And she's now an advocate for long COVID, and she seeks to provide education and hope for others who are living with this invisible disability. So really wonderful to have you here with us, Tammy. Welcome.
Thank you.
So to begin, maybe if you can just give us some more context around, what this last, year and a half has been like now, living with post-COVID syndrome.
So as we had spoken about, I contracted COVID back in March of 2020. And we had really no idea the aspects of what was going to happen later on. I had a mild, moderate to moderate case. I treated at home. I was not hospitalized. And after that, I did recover from that. I still had a cough for about 3 months following that. And then sometime in late May and early June, I started to notice an onset of a lot of bizarre symptoms, some of which was like just getting like lightheaded and my heart rate racing. And at some point then I thought maybe I should check this out a little bit further. And I got a pulse ox and a blood pressure cuff. And I noticed that I was having some severe fluctuations in my blood pressure, and my heart rate was just insane. I ended up in the ER a few times with just a lot of different symptoms and aspects. And unfortunately, my testing all came back completely normal, with a little bit of, they did notice the tachycardia and the blood pressure fluctuations, but they said there was nothing wrong with me. So at that point, I kind of just had to dive in and fight for this on my own. So some of the symptoms were pretty severe and debilitating. The fatigue was completely overwhelming. There were days I could not function. By July, I was completely incapacitated, to the point where I had to move out of my husband's home to my parents so that he could work and my parents could take care of me. And there were days that I literally could not get out of bed. And it was extremely difficult. And then after that, facing the fact that the doctors were telling me I just had anxiety or just dismissive of my symptoms, was completely just devastating to me, because I knew something was not right. And at this point in time, I am now, as of June 10th, on my 15-month of COVID long haul. And thankfully, I went through most of this on my own, and with the help of and support of my parents and my family. And we advocated as best we could, but I really didn't get anywhere. And I pretty much dealt with this all by myself and looked things up and researched. And eventually I came across some fellow COVID long haul warriors and a few groups, and that was my saving grace. But I unfortunately didn't find them until November of 2020. And since then, I've just been trying to make sure that people didn't really have to do this alone anymore, and that there are people like us out there, and we're willing to help and support each other. So that's kind of where I'm at right now. I'm seeing some improvements in my symptoms, thank God. And I'm slowly coming out, but I'm still experiencing some lingering effects at this point. So that's kind of my backstory.
Yeah, in a nutshell, right? And there's a lot there, and I wanted to maybe speak to this part of your experience that you had mentioned about, visiting different doctors and having, these blood tests. And, I think a really, really common experience with us long haulers is, having these blood tests, or other tests, x-rays, you name it, and it's all coming back normal, right? Like, oh, by these medical standards, you're fine, but wait,
Right.
I'm very much not fine, and like I know that. So, what are some ways that you worked with that? How did you cope with that and, feeling like it, like you had said, doctors not believing you or being dismissive.
That was one of the hardest aspects to deal with. In the midst of the most intense suffering of my long haul in the beginning, I'm going to say about months 4 and 5 were probably my absolute worst. Unfortunately, there was not a lot I could do. I literally was too sick to get out of bed. But I spent a lot of time thinking and praying, and with the support of my family, I was so grateful that I had them, because there was no way I would have got through this on my own. During those particular times, before I was hospitalized with some heart issues, I kind of just suffered through and got through what I could. At the end of that time, even though I was still suffering fairly intensely, I saw some improvements, and that gave me hope that there could be, light at the end of the tunnel, so to speak. And it was at that point in time, after seeing several doctors and being dismissed and told I was just anxious, or I had mental health issues, or, there's nothing wrong with you. I was angry, and I said, you know what, nobody should go through this. And so at that point in time, I just started educating myself in hopes that I could bring our little rural area of Pennsylvania up to date on what was actually happening to people after COVID, because, we lived in an area that people didn't really feel like it was real, and that there were no problems and you recovered and it was just the flu. And I was on a mission at that point. I'm a person of action. So at that point, I decided that I was going to just research everything I could possibly research. And with the help of some friends, and on the days that I was feeling well enough, I spent a lot of time just researching. And to me, education was power. And I think that finding other people complaining of things, I can't even tell you how many articles I read on the subject. And then I started reaching out to people. And that's when I realized that there were thousands and thousands of other people just like me, that this was not in my head. And I used that, and I went for it, and I started to try to find ways to help people.
And what a powerful moment. Yeah, in a way to cope, and finding support within, whether it's your community or finding that virtual community of long haulers and others who are getting through the best that they can. It really sounds like this self-education piece was really a huge part of your recovery process, and doing what you can to educate yourself, and reaching out and finding ways that you can get the support that you're needing.
Definitely and absolutely. And at some point in time, I did start counseling, just because I just felt like I was getting nowhere and I wasn't feeling validated, and the dismissiveness. And I know other people have spoken about this, but it was almost like a PTSD situation where you were afraid to go to the doctor because you knew you were just going to be brushed off. And to the doctor's benefit, that not a lot of people, especially in our rural area, really understood or knew what long haul. Like, even to this day, I'm still getting, I don't know what long haul is. And so it was just one of those things that I felt like I needed to talk to somebody to sort of process things. And I really think that also added to my at least mental recovery, in the aspect that she believed me, she listened to me, she understood, she did research, and she said, you know what, you're my first long haul case, and I would really like to know more. So she's also been a fairly good advocate for us. And so to me, that really just helped a lot, just knowing that somebody would listen to me. And like I said, my family has been phenomenal. I know not everybody is as lucky as me, but I could not have done any of this without my family, especially my mother.
There's such a strong element and a strong sense of healing that comes from that support, right?
Yes, it does. It
and
does.
leaning into the family members, and parents, mothers, friends. Do you mentioned that you live in a rural area, and as you've been just alluding to that, there's some challenges that come with that, in terms of maybe access to medical care, maybe just information within the healthcare system where you live. Just curious if you have any sort of advice or or wisdom that you might want to impart on people who might be listening, saying, yeah, I live in a rural community, or yeah, I'm having trouble kind of getting the care that I need. What sort of advice might you give those people?
Well, I definitely, one of the biggest things I'm still saying is not to give up and to keep advocating for yourself, because you are the most important person in your life. And at this point in time, you know, there's still a lot of education to be done with COVID long haul. And so I would say whatever your energy allows, definitely just keep going and keep fighting and keep reaching out to the rest of us and long haul groups and support groups. As far as any medical care is concerned, I'm currently in Pittsburgh, as I mentioned, getting testing for dysautonomia and several other components of things that have gone haywire since I've contracted COVID. And at this point, I've had to realize that I've had to travel to get any type of real care. And I was blessed with a doctor here in Pittsburgh that listened to me and believed me and cared about what's going on with me, and was able to finally, after 15 months, get me the testing I'm needing. But she was with me for a good portion of the last 6 months and trying to help me figure out what's going on. And that's invaluable. So even if my advice would be definitely to find a doctor that listens to you and believes you and truly understands or tries to understand or educates themselves or learns alongside you to help combat this, because I know that this is not going to end as long as COVID is around, as long as other viruses are around. You know, that this post-viral syndrome, in whatever form it takes, whether it's COVID or any other post-viral illnesses, they're real and they're going to be here with us. So I think it's really important to just keep finding people that'll listen and try to understand what you're going through, or at least be able to say, you know what, I don't know what I'm doing. Let me find somebody that does. And I think that's very, very invaluable in your care and recovery.
And something very empowering, I imagine, because you had said it just a moment ago that like you are in charge of your own care, right? And you
Yes.
are the one responsible for the quality care that you receive. So, finding a doctor, finding people who can be a part of your care team, your support team, that are helping you and playing an important role in your recovery process.
Absolutely.
Yeah, I just keep coming back to this, idea that it is in community that we heal.
It is.
That we don't do this alone. And you had mentioned, Tammy, that you do have a history of other chronic illnesses and autoimmune conditions. Do you feel,
Yes.
or how do you feel that has played a role in your recovery from COVID?
I do think that it has been challenging dealing not only with a post-viral illness, but then it sort of have what word am I looking for? Exasperated any or all the other symptoms of my other illnesses. Like, I have fibromyalgia, my pain levels have skyrocketed. And even now, 15 months later, I'm still dealing with a lot of discomfort and pain. And I know a lot of other long haulers can relate to this. The chronic fatigue ME diagnosis I got after a bad virus a few years ago, actually several years ago, and I had recovered from that. After I contracted COVID, I noticed that had intensified to a level that I have never seen before, which resulted in me being practically bedridden for months. And the fatigue was just insane. So I think it was one of those things that you just notice that whatever you already have going on, in a lot of cases, do get a lot worse with this. And people really just need to learn to take care of themselves and not push through when they need the rest that they need. Because not only are you dealing with the virus and the post-viral syndrome, but then you've got worsening symptoms in your other areas. And I really think it's important that people take care of themselves. And that would be a really big piece of advice that I would give anybody trying to recover. Don't push yourself. Just learn your limits, even though it's really hard. And take care of yourself as best as you can to try to get through this, because pushing just makes things worse.
Yes. Oh, this makes me remember the days of, you feel one day feeling better and then the next day feeling like you've just pushed yourself too much and taking 10 steps back. It's a learning curve, right? Because it's not just ordinary life that like, okay, I know how to handle my self-care. I know how to handle my, my fatigue. It's a different ball game when it comes to long COVID. And
It
there's
certainly is.
new things to learn about yourself. But you mentioned taking care of yourself. Yeah, that's incredibly important. What are some things that you have done to do just that?
Like I said, I was very blessed to have the support of my family. If there were things I couldn't do, they did for me. Even my husband, who he works at a prison and he's gone a lot of hours. Even when I came home from my parents, he was very helpful in making sure I didn't overdo it. It was a struggle, I'm not going to lie. With the help of my counselor, I really learned to pay attention to myself, and realized that if I pushed so hard, I was going to be either bedridden or miserable for a couple of days, if not a week. So I really just started to pay attention. It was a learning curve for sure. I'm still failing at that sometimes, and that's okay, because I am starting to see a little bit more good days after 15 months. I still got to remind myself that it's okay to do things, but don't overdo it. And I think I've really got a long ways to go yet to be back to my full pre-COVID self, but I'm seeing progress. And because I rested and learned to understand what my body was telling me, and paid attention to those things, I really think that was important, to help me get through some of the rougher times and prevent some of the really harsh relapses that sometimes come when you do that.
Yeah, I think it's really important to, to note that, yes, this is important to, listen to your body and pay close attention, but that's not all, that doesn't always happen. Like sometimes, sometimes we don't listen, right? And sometimes we're like, oh man, now I'm not feeling well. And like you said, that's okay. Like having that grace with yourself to be like, okay, I'm learning and I'm doing my best and trying to take care of myself. And sometimes I'm not perfect, but I do what I can. Mm-hmm.
Absolutely, yes.
Yeah. So are there, I know sometimes it's difficult to see the good that can come out of something that is just so bad and miserable, and maybe even, I know for me, some of the darkest days of my life, uh, recovering from COVID. But are there some takeaways that you might be pulling from this to help you along, whether it's your own self-care process moving forward or just how to live as a human being?
Yeah, absolutely. There's a very short story I'll share with you in regards to my recovery process. Back in probably about July, I had just gotten released from the hospital. They did a complete cardiac workup. And, of course, I was still having the tachycardia and the palpitations and all that, and the dizziness. And the testing was normal. Structurally, my heart was sound, but my pulse rate was not. And I was trying to explain to my cardiologist, I really just don't understand what's going on. And we were trying medications that I couldn't tolerate. And I got to the point, and you said about dark days, I got to the point where there was a day that I literally laid down on my parents' living room floor and cried, because I knew that nobody was believing me. I knew that I couldn't take anymore. I could not go on. And a little emotional. So it was at that point that I knew that I had to pick myself back up and keep going. Sorry. It was a very humbling experience, knowing that I had reached the end of the point where I could tolerate anymore. And after I cried, I sat up and I said, you know what? This isn't going to happen to anybody else. Yeah. Nobody should go through this. And that's when I got angry. I think I mentioned that earlier. And I just started researching. And I think, and I'm going to go back to what I said earlier, education is absolutely key. You cannot go through this with blinders on, because unfortunately, if we don't educate ourselves, nobody else is going to, at least until they get caught up. Because I know the doctors, at least some of the doctors, are really trying hard to understand what we're going through. They're just not seeing it unless they've experienced them themselves. There is so much education that needs to be done, and that's where my passion and my heart is lying right now. But I think at this point, I'm going to go back to what I said earlier. Just take care of yourself. Don't give up. When you get to those low points where you're laying on the floor crying, or you can't get out of bed, or your dog is once walked, or your children, need help with something and you can't do it, just realize that it really is okay. And things will eventually get better, whether you find good care or good medications or a good treatment center, because the COVID treatment centers are popping up. At some point in time, there's going to be a point where you're going to be able to find the right doctor to help you. Through counseling, you'll be able to even if you don't fully recover, like this may be my new normal, but I've got good support and good counseling to accept where I'm at and be able to know that it's going to be okay. Even if I am not fully myself again, it's okay. And I think that the more you educate yourself, the more you advocate for yourself, the better off you're going to be. And like I said, my passion right now is to help others so they don't have to go through that moment of lying on the living room floor by themselves anymore. I think it's real important to reach out to support communities and be able to help people and help each other through this, because nobody understands like a fellow COVID warrior. So I think it's important to take away that it's okay to reach out for help and ask and put your soul out there with your support groups. And people will understand and they will be supportive. I found it incredibly helpful. When I joined the COVID-19 advocacy project, it was like I met another family, and they've been extremely supportive, and I am very grateful for that.
Such truth and power and wisdom in those words. Thank you so much, Tammy, for sharing and really bringing that authentic side of your journey into this conversation. And I can't help but like wiping tears out of my eyes because, there's on more than one occasion that I was crying in my closet, and my husband literally picking me up off the floor, because I just felt like it was so overwhelming, the battle. Yeah, so it's feeling that I'm there with you, and thank you for speaking to that, and speaking to this side of asking for help and leaning into that support, and that can be something really difficult. I had a hard time asking for help because we want to be strong, we want to say no, I can do it, but leaning into support can be so empowering in that way too, and bringing people into your circle and saying here, because people want to help, right? They want to help you along your journey because they want to see you feeling well.
Yep. I mean, you are gonna run into people that are not able to understand, or
of course,
I don't know, maybe dismiss things. Even friends and family are like, oh, it's not that bad, and it really is. It really can be. And if you're not finding support with that person, it's okay to turn to somebody else or back to a support group. And I would strongly encourage finding one online that suits your needs. I belong to 3, and I'm finding so much support in those areas. It's just unbelievable. And I don't think anybody will understand you any better than somebody else that's going through the exact same thing that you are. And that I find that very helpful.
Absolutely. And just in our remaining minutes here, Tammy, any other thoughts or recommendations that you would like to provide for people who maybe are feeling like that battle is just so overwhelming?
Gosh, that's a really good question. I think I'm just going to keep going back to my original answers to some of the other questions. Is just don't give up. Reach out for that support. educate yourself, find a doctor that listens to you and truly cares about you. There's so much more information out there now than there was, 15 months ago. It may not be widely spread at this point, but we're working on that. And people like myself and Karen Bischoff from the COVID-19 Advocacy Project and other people that have been rallying for us. We've met with senators and that type of thing. There's a COVID bill currently in Congress that was introduced that we went and advocated for, and we spoke with our senators back in April. It was a wonderful experience. I'm at a point in my recovery that I can handle these things. The brain fog is still there, the fatigue and all that stuff is still there, but I'm at a point in my recovery that I can actually participate in that. I think it's very important when somebody is ready that they find ways that they can help spread the word, legitimate information, education. I think that's going to be very, very important for us as long haulers in the future, even in the coming weeks and coming months and maybe years, as more and more people develop long haul COVID or other chronic post-viral illnesses or other chronic illnesses in general, like, the chronic fatigue syndrome. I've dealt with that for a long number of years. And there's always a need for people to understand what these invisible illnesses are, because we may look fine on the outside, but we are not. And I really would like to see more people educate the general public and even the medical community in those areas, because I really think we need the recognition and the compassion and the treatment going forward. And I really think that when anybody is able and willing, that they can dedicate their time to help us spread the word, that would be incredible. The more people that get it out there, the better off we are going to be.
Because in community, we heal.
Yes, ma'am.
Well, thank you so very much, Tammy, for being here with us and sharing your story. And it's just been such an honor to hear your words of hope and inspiration, and as we're all moving forward in this. So thank you again for being here.
I appreciate the opportunity. Thank you so much.